Sarah madam, this year we are celebrating the 87th birthday of Bhagwan, and it is also the occasion when we celebrate the 21st anniversary of this hospital which Bhagwan started in 1991. The first operation was done in this department, and you have been part of this department for more than 20 years now. So tell us, how has the journey of this department been all these years, right from the time Bhagwan came and inaugurated the hospital?
Yeah, 21 years. It sounds very long, right? So we recollect when Swami inaugurated this hospital, that is 22nd November 1991, and now we are just 2 days away from it to complete the 21 years. From the time I joined, that was somewhere in the 1st of February 1993, till now, I can say very proudly that we have grown, we have benefited thousands of people in this institute. This beautiful building that you see around, which stands tall and proud today, ever since Swami has started, since the inception. And in this 21 years, there has not been a day where we can say we had to stop doing cases, surgeries, because we ran short of some supplies or oxygen or drugs, any consumables which are needed for surgery. And be it the costliest of the surgery, if it was going to benefit a patient, it had to be done. So the motto was laid down very clear that whatever was going to benefit a patient had to be done, irrespective of the cost involved. And this, I can say proudly, that this has remained the motto throughout. And I can say today that in this 21 years, we have performed, like till date from the inception, 22,527 cases. And these are all pure cardiac surgeries alone. And I want to know if there is any hospital which can boast of this number, where they have done this absolutely free of cost and keeping the motto of patient care as its topmost priority, giving it the topmost priority. The personal touch and the humane touch which a patient gets in this hospital, I think is rarely seen in any other hospitals. So we see, I mean, the patients enter this hospital, they come smilingly, they go smilingly. That is very true for our hospital. And because we are doing it free, can we say that we are doing, we are using cheaper materials? No, that's not the fact. We are using the costliest, we are using latest state-of-the-art equipments. We are using what is the standard level of care in the international level. We are using all those things, products. So when we talk of a surgery, a cardiac surgery, what all goes into it? With the latest technology, with the latest skill. When it comes to skill, we are even adopting the latest surgical skill or the surgical method which is there being done in the other hospitals at the international level. So all that is done and which will benefit the patient.
Would you like to say something about the journey of the department, like with what kind of cases we started with, and then now how we have progressed, and where do you see the road ahead?
Yeah, see, initially when the hospital started, there was an AIMS team which used to come and perform surgeries at periodic intervals. That just lasted for less than a year. Within less than a year, the department had stabilized with 2 to 3 regular, fixed people, who were permanent members of the team. So from there the journey began. Slowly and surely we started doing simpler cases to begin with, and within, we can say, in a 2 to 3 years time, we had started covering all the range of cardiac surgeries. Today I can proudly say that we perform all kinds of cardiac surgeries, from congenital to semi-adult to adult, what we say pediatric to adult, geriatric, barring heart transplants. We are performing all kinds of cardiac surgeries, and especially when we have a visiting faculty from abroad who sees our ICU, they find a 3-kilo baby on one cot. The next cot they will find a 60-year-old patient. They will find a very young other baby. There will be a mix of congenital cases. There will be a mix of valvular cases, then bypass surgeries. So he is amazed, he or she who is walking into our ICU is amazed that how can we have such a mix of cases. So this can be seen, I think, in our ICU only, I would say, because nowadays the trend is to be either only adult or only pediatric. This kind of mix and doing all variety of cases is rarely seen. And I would say we have very good results. I cannot say that we have nil morbidity and nil mortality, but we have very low mortality. We have less than 1.5%, which is, I think, even less than the international standards. We have very low infection rate. And overall, over the period of years, we have stabilized to the extent that now we have around 6 to 8 regular members of the team in our department. In 1994, we were recognized for diplomat in National Board Training for Cardiac Surgery. So we started taking students from 1994. And now I can proudly say that from next year, we'll be taking 2 students rather than 1 in a year. And having stabilized now on the surgical skill front, the focus is that we will do more of complex congenital cases. I have always wanted that ours should be a center of excellence. Now much more, if we call it more super specialization, where we are able to do like less than 3-kilo baby, for which we already have procured, like say 2 infant care warmers. These are the equipment you should need because you need to keep the baby warm. So we already have procured them, and which have got also ventilator facilities. So that has already been procured, and we want to go for the neonatal cardiac surgery program in a big way. So that is going to be our focus in the next coming years. The second focus is on the academics, research and publications. I can proudly say that last year our department has done more than 20 publications in the international journals. We have presented very rare cases which we have seen. We have presented them in the conferences, in the journals, and they have been, they have been widely acclaimed. We want to make this a center for education and training, because I think with our experience now over this 20 years, we have got so much of variety of cases which we can, we have especially a variety which we say ventricular septal defects with pulmonary hypertension. It's a category where abroad it's already known that beyond 2 years of life, if you operate, the quality of life is not going to be so great. But we have seen cases at 30 years of life, we have operated on them and they have come back to us after 5 years, 10 years, and they are doing absolutely all right. So we have started a study on this where we are going to take lung biopsy. We are going to send this tissue to the electron microscopic level, histopathology level, and we are going to try to see the changes which occur in the arteries of the lungs, to know whether what has been told so far, is it true or is it something different, or is it that the Indian population or the Asian population is different from what is said abroad. So this is one aspect where we want to, and we see a lot of coronary artery disease patients with very severe stenosis, what we call them as walking and talking left means anywhere else they would have been rushed into theatres and got operated. But our patients come to us with their CD film and show it to us, and this angiography has been done a year ago or 2 years ago, and they are moving around. So this is again a myth that you should rush them into theatres immediately, because we have our own share of experience which says that this may not be necessarily true. So these kind of things little bit we want to now study this and try to say that yes, this may not be. We may say the epidemiology of the cardiac disease may have to be rewritten according to us, but for that first we will have to do the analysis and study it a bit. So we want to focus also on that. One is academics, research as I said, we want to slowly start doing more study, this different case scenarios which present to us in a different pattern as compared to what normally is the natural history, of a disease. So we would like to change that. And we are trying to go for a third theatre. Like we have only 2 cardiac theatres. Our workload is so much. We have waiting list of certain category of cardiac ailments waiting for 5 years, 10 years, 7 years for the want of, not able to do. So we are planning for a third operation theatre, and which will again give an increase in the number. And we hope to, cut down our waiting list by increasing our number of surgeries. So that is another immediate plan right now. See, I had done one complex congenital case in a 3.5 kilo baby, and everything had gone. It was a long day, but by evening we had shifted the baby to ICU. She was doing fine, and then around 3 a.m. in the morning, she had a cardiac arrest. So I just could not believe it, because everything was going so fine. So I just prayed to Bhagawan that this cannot happen, And I just, that time Bhagawan was in Bangalore. And that time a lot of people would go on their weekends to Bangalore. So I had one group going to Bangalore. So I rushed to give a letter to Bhagawan. They had come to take the letter from me. So when I went and delivered the letter and came back, everything had fallen into place. Child had become absolutely fine. And that child went home, and just 2 months back the child has grown up and had come back and has put on weight and is absolutely leading a normal life. So this kind of things are very gratifying to us. A child who would not have survived beyond a month or so of its diagnosis, of its ailment. It's a transposition of great artery case. It's a complex case, complex congenital cyanotic heart disease case. So this child goes home, comes back. So these are the moments which are very gratifying to us. Similarly, another congenital case, that baby had to be carried everywhere around. Baby could not walk and all. So we operated on this kid, and everything was fine with the baby post-operative period. But baby was draining fluid from his chest, what we call as pleural effusions. That was not stopping at all. So we had this rare privilege of all the time when we go for darshan, Bhagawan would come and ask us how are the patients, how is the hospital doing and all. So I had this, I was lucky enough to bring it to the notice of Bhagawan. I said, Swami, everything is fine with the baby, but this pleural effusion of the baby is not stopping. So Swami asked me, what is the weight of the baby? So then he, in all his mercy, he materializes the vibhuti and gives it to me. And then, as we all know, the rest is history. Like, the effusion stop, baby goes home, and then when he comes in his next visit, he comes running towards us. So he has gained weight, he has become, it's normal. So this kind of case scenarios, when you sit back and reflect, they fill you with a lot of joy and happiness, because this is where it matters, between life and death, between going back to a productive life. Then we had so many instances are there like that. We find that a mother, a young girl, she had undergone a surgery in a very prestigious institute in Mumbai, that is KM Hospital. But now when she needed one more surgery, they were not able to do it, because again they were financially not able to. This girl was already married, she wanted to have children, and we took up this case, and it was a challenging case. It's a tetralogy of Fallot with severe pulmonary hypertension. It's a very bad combination where you can have the risk of loss of life and all. But we took it up because we knew there is no other option for this girl. Otherwise, down the line, she is going to not make it. So we operate on her. She becomes fine. She goes back home, and now she is a proud mother of 2 kids. So all these kind of case scenarios are there. So many instances where how this hospital, this surgery, and it makes a difference in person's life. And this kind of things, when we reminisce, it fills us with a lot of happiness and joy.
How do you feel Swami's presence now, post 2011?
I think Swami has never left us, because we feel his presence continuously. He's guiding us in all, I wouldn't say only on the professional front. He's guiding us, guiding me in even personally and in all walks of life. in all my ups and downs. I feel his presence. So our institute, I think, is growing, and it's going to be definitely, I think right now too many people do not know about it. Swami had kept it, I think, like a in a shell, or what do you say it, not allowing it to be infiltrated by the outside world. But I think very soon this shell is going to be broken, I think. It's a small place, but it's the kind of work which goes on here. I think you people have to come to see and believe it, the level of work which goes on here.